Postpartum depression is depression that occurs following childbirth. Symptoms include sadness, hopelessness, mood swings, and thoughts of self-harm. According to WHO, 10 to 15% of women experience postpartum depression. Risk factors include lack of support, marital conflict, financial stress, and anxiety and depression during pregnancy. The treatments for postpartum depression are counseling, cognitive behavioral therapy, interpersonal psychotherapy, and antidepressant medication. There are lots of reasons why a woman might struggle to get help, such as a lack of awareness, lack of childcare services, concern about antidepressants and breastfeeding, and stigma and fear. It has a big impact on the mother, giving them a lower quality of life, an increased risk of psychiatric disorders, and a 4 times greater risk of suicide. It also impacts the physical, emotional, cognitive, and behavioural development of the newborn child. According to the Australian Institute of Family Studies, postpartum depression costs the economy $7.3 billion per year. In 2016, O'Connor and researchers conducted a systematic review on postpartum depression. A systematic review is a study that collects and analyses other studies to answer a research question. The aims of this study were to analyse the benefits of screening and treatment of postpartum depression, the harms of screening and treatment, and to find out which screening tools were the most effective. They collected studies from 2008 to 2013 and analysed them to make sure they met the criteria. The studies had to use the Edinburgh Postnatal Depression Scale or the Patient Health Questionnaire. The woman had to be over 18 and pregnant or postpartum and didn't have any other health conditions. The results of the study found that after screening there was a decrease in the rates of depression. The Edinburgh Postnatal Depression Scale was very effective, but there wasn't enough data to analyse the Patient Health Questionnaire. Cognitive behavioural therapy was an effective treatment, but there was a slight risk with antidepressants and breastfeeding. These results show that screening is very effective at reducing postpartum depression in women. Good quality studies like this means that postpartum depression screening can become a standard practice, meaning earlier detection, early treatment, and better health outcomes for women. Future research in this area could work on identifying women at high risk and developing better treatments, working to overcome the barriers, and implementing screening globally.